Government-run healthcare is not Marxism. It's not communism. It's not even socialism. The only people saying it is, and they keep saying it over and over again, are the billionaire corporate health insurance companies and the politicians who they lobby and pay millions of dollars to keep telling you falsehoods about government-run health insurance. They have been outright lying to you for decades, and they continue to do so today. You hear it all the time, and that's what this video is about. The big lie about government health insurance and why the politicians don't want you to know the truth. There are only 8 countries in the world that don't have universal health care. Those countries are Iran, Egypt, Nigeria, Pakistan, Afghanistan, Yemen, Syria, and America, the good old US of A. It's a good thing that our politicians are protecting us and they're emulating and sharing a healthcare philosophy with these countries. But, there's not one Western democracy, a modern economy in there. What are they doing? Why are we doing the same as these countries instead of all the successful ones in the world? I've never really understood and actually been really perplexed by the gullibility of Americans and American voters. It doesn't matter if you are a conservative or a liberal, a Republican or a Democrat, a progressive or a MAGA. You all buy the same bullshit that's given to you and fed to you year after year after year. There's a number of issues where the intention of the American public is clear, and politicians continue to do the opposite of that. They don't do what you want, and people just accept it and put up with it, and I really don't understand that. Just off the top of my head, abortion. The vast majority of Americans, every poll shows, are in favor of women's reproductive rights. Politicians, you wouldn't know it by listening to them. Gun control. Look, there is a problem with gun violence in America, and American voters are willing to accept some gun controls, not the politicians. And then we come to today's topic, health care. Have you seen what's happened the last week? Americans hate their health care system, their health insurance system so much that there's widespread applause about the assassination, the cold-blooded murder of the CEO of a health insurance company. Americans are laughing at it and saying, he deserved it, who cares? Now, if that's not disapproval of the status quo, I don't know what is. But somehow, politicians are not reacting to your wishes, and you guys just keep accepting it. And we're going to get to the bottom of that today. This deception has been going on for generations. It even predates, in many cases, your parents and your grandparents. Way back in the late 1950s and early 1960s, a lot of Western nations, modern democracies, were considering, proposing, and often implementing government-run healthcare programs. And there was a lot of talk about that in the United States, too. But the AMA, the American Medical Association, who represents American doctors, launched a campaign opposing the Democrats' intention to extend Social Security to include health insurance for the elderly, which would later become known as Medicare. They called this Operation Coffee Cup. Doctors' wives would organize coffee parties in their homes to convince friends and neighbors to write letters to Congress opposing this proposed program. They even got well-known young actor Ronald Reagan, who supported their efforts, to produce an LP record called Ronald Reagan Speaks Out Against Socialized Medicine. That record was played and listened to at all those coffee meetings.
My name is Ronald Reagan. One of the traditional methods of imposing statism or socialism on a people has been by way of medicine. The doctor begins to lose freedoms. It's like telling a lie, and one leads to another. A doctor decides he wants to practice in one town, and the government has to say to him, you can't live in that town. They already have enough doctors. You have to go someplace else. all of us can see what happens once you establish the precedent that the government can determine a man's working place and his working methods, and behind it will come other federal programs that will invade every area of freedom as we have known it in this country, until one day we will awake to find that we have socialism.
As Church Lady from Saturday Night Live would say, well, isn't that special? Could it be Satan? You know, sometimes you gotta laugh, because if you didn't laugh, you'd cry. Gotta keep a sense of humor. Here we are, some 60 years later, and healthcare is still a nightmare for many, many people. It's destroyed a lot of families. You know, so we've got Donald Trump. He's the great disruptor. He's the anti-establishment politician, the unpolitician. What does he got to say about healthcare? Well, he's going to check with the corporations to see what they have in mind, if maybe we can work something out. Watch this interview he did just this week.
That they voted no. I wish John McCain, he fought for 10 years on replacing Obamacare for 10 years, and then he voted against. Nobody understands it.
Sir, you said during the campaign you had concepts of a plan. Do you have an actual plan at this point for health care?
Yes, we have concepts of a plan that would be better.
Still just concepts? Do you have a fully developed plan?
Let me explain. We have the biggest healthcare companies looking at it. We have doctors. We're always looking, because Obamacare stinks. It's lousy. There are better answers. If we come up with a better answer, I would present that answer to Democrats and to everybody else, and I do something about it. But until we have that, or until they can approve it, but we're not going to go through the big deal. I am the one that saved Obamacare, I will say, and I did the right thing. I could have done the more political thing and killed it, and all I had to do is starve it to death.
You did try to have your Justice Department effectively kill it, though,
No.
sir.
Kill it from a legal standpoint, but from a physical standpoint, I made it work.
In your concepts of a plan, sir, will people with pre-existing conditions still have coverage, and can you guarantee their prices will not go up?
The answer is yes, they'll have coverage. You have to have it.
So Donald Trump really doesn't have any solutions for healthcare. He's got the concept of a plan. After all these years, he hasn't got a plan, but he'll figure it out. Together with the billionaire corporate executives of the health insurance companies, whose only concern is maintaining or expanding their exorbitant profit of billions of dollars a year. And any suggestion that Trump somehow saved Obamacare is just absurd. Trump and the Republican Senate wanted clearly to kill Obamacare and to repeal the Affordable Care Act. They were on their way to it. It was a really close vote. It was only John McCain, a Republican senator, who stood up and made a heroic thumbs down, which saved it, and it's the only reason you have it today. If Trump had his way, it wouldn't exist. Now, just so you don't think I'm picking on Donald Trump, the Democrats have got all their issues with health care just as well. When Barack Obama got elected in the 2008 election, health care was a big deal. It was his central platform, his central policy. He was advocating government health insurance. He got elected. Not only that, the Democrats had the House, the Democrats had the Senate. They could have passed legislation, but they didn't, because too many Democrats opposed it. There are a lot of Democrats to this day who oppose government-run, single-payer, universal Medicare. Go figure. So, you know, it's on both sides, okay? For some reason, Americans and American politicians resist government-funded health care, and that's crazy, because it works so well. Not perfect, but it works. Compared to what you have in the States, it works well. Universal health care, universal Medicare, government-funded, single-payer health insurance is really based on the concept that health care is a right that every human being is entitled to. I'm going to read you a quote here from Professor Lawrence Brown, Columbia University, New York. Respect for human dignity demands that no one refrain from seeking medical care for fear of the consequences of doing so, and that no one suffer financial adversity as a result of having sought care. The moral foundations of universal coverage are as simple as that. And that's really what it's about. It's something I've cared about all my life. Now, I know all the arguments against government-run healthcare. Costs will be high, there'll be lineups, there'll be waiting lists, there'll be no innovation. That's all false. And I'm a person who supported it for years and years. I know every argument is going to be, and I can refute them all to you one at a time. When I ran my company, which I sold in 2005, we had employees throughout North America, had a lot of people in the States. And I wanted to make sure that my American employees got the same healthcare benefits as we had in Canada. So in Canada, we had our OHIP, our government-run insurance, plus we had a private plan that added supplementary things, including dental care, vision care, what have you. I ended up buying a policy for my American employees that cost me $500 a month. Okay, $6,000 a year per employee to match the benefits that my Canadian employees were getting. Salaries were much the same, but the Canadian employees had that coverage, the American didn't. And one of the problems with the American healthcare system is that so many people have healthcare through their employer. And if you lose your job, if you're let go, or if the company goes bankrupt, your healthcare is gone and you may not be able to replace it. I showed you the list, that impressive list of all those countries that do not have universal health care. Now, who does have it? Okay, Australia, Brazil, Canada, China, Denmark, England, France, Germany, India, Israel, Italy, Japan, the Netherlands, New Zealand, Norway, Singapore, Sweden, Switzerland, Taiwan, not the United States. So there's obviously, when you run government health insurance, there are issues that come up. And those people who are trying to prevent you from getting it will just bury you with stories about those things. They don't look at the nightmare that the current American healthcare system is. The costs of the American healthcare system are considerably higher than any government-run insurance program. So they keep saying, well, your taxes will go up. It'll be more expensive. No. The statistics, the facts, the reality is government-run health insurance is actually less expensive to the GDP of a country than the private system is. And you don't get two-tiered, three-tiered, or four-tiered. I mean, in the United States right now, if you're a billionaire, you get great medical care. Sorry, my mind wandered. I thought of how Donald Trump was treated when he got COVID compared to how the average person was. I mean, and it's not just for the president, it's for the wealthy. Even for the upper middle class, they get better health care than the working poor. And I don't begrudge them getting great health care. I think everybody should get great health care. And universal health care is an attempt to do just that. So, I'm going to wrap things up for now. I want to thank you for watching this video, especially if you stayed up until the end right now. I don't know if you realize, but with YouTube, the longer people watch a video, the more airplay it's going to get. It's one of the measurements that they keep track of, and it makes a big difference. Now, I know you've all heard this before, but if you enjoy this content, you could help me out a lot by, number one, liking the video. Number two, make a comment. Write down some thoughts, opinions of what you think about the video, and subscribe to the channel. Those things make a big difference, and without that, I won't be making more content. So once again, I want to thank you for taking the time to listen to my thoughts and opinions. They are just mine, but I'm glad to share them, and I want to hear yours. Thanks an awful lot again, and you have yourself a wonderful week.